am talking with Dr. Skora today. Hi, Dr. Skora.
Hey, everyone.
So we're going to talk about prepping for your fertility treatment once the COVID-19 pandemic has kind of calmed itself down and we are back to business as usual, which I know you, Dr. Skora, and all of our physicians, our nurses, everybody is just like counting down the minutes for this to happen, especially for our patients, because we know canceling was such heartbreak for them. And it kind of goes against our very nature for what we do to not be able to help our patients every day. So we'll just kind of dive in. So a lot of our patients, you know, when ARSRM released their guidelines saying basically we needed to halt all treatment or most all treatment, a lot of patients were, you know, ready to start their IVF cycle. What do you recommend that they do now, kind of while we're waiting to get back to business as usual?
So in terms of IVF specifically, if you are in the process of getting ready, either on birth control or waiting for a period, I would just wait again for a period. I think everyone who was on birth control waiting for a cycle start, we have taken off to return to their normal cycles. We are encouraging all of our patients with their April period to call in, to check in to see what's happening, if we have any updates for you guys in terms of when we think we're going to be able to start. If your period's going to come in the first week or two of April, probably safe to say we're going to have to wait for your early May period. But if your period's towards the end of April, I would encourage you to call just to see where we are, if we have any updates for you about when we can start. Because if we're able to start mid-May, which is what we're hoping for right now, then if that's the case, then we might be able to start you on a birth control pill end of April if that's when your period falls. Otherwise, doing the normal things that we recommend pre-pregnancy, I think is really important, and pre any procedure. So I tell all my patients optimizing weight is really important for fertility treatments. I know it's really difficult when you're cooped up in your house to think about losing weight. I'm just thinking about what else I can stuff into my mouth. Luckily for me, I have a workout bike.
Nice.
A lot of people don't. So, you know, keeping that social distancing, going on those walks that you can do while we can, I think is really important. And optimizing that weight. Also, just eating healthfully. Don't take this as an excuse to be eating junk food and processed foods. Keep trying to eat your healthy foods, frozen vegetables, frozen, you know, proteins and things like that you can keep using is really important. Don't run to that bag of chips all the time, okay? Other things, you know, the supplements that we recommend all the time for our patients who are considering to get pregnant. So continue taking your prenatal vitamins. CoQ10 is a great supplement as well for our male factor and fertility patients, that daily multivitamin or whatever your urologist has recommended to you. Keep taking those medications, okay? And just live a healthy lifestyle. Don't take this anxiety to drink heavily the way, you know, that some people do. And, you know, there's been a run on liquor stores, it seems, but, you know, moderate drinking is fine, but, you know, and then don't take this as an opportunity to start smoking or vaping if you don't already, okay?
So what about those who were just primed and ready for their frozen embryo transfer, their FET?
So this was really terrible. You know, I had to cancel several of my own patients like the day before they were supposed to start progesterone. And I know how heartbreaking it is for our patients, but it's heartbreaking for us too. We have our hopes up for you guys as well. So for those patients, same thing, you know, continue your prenatal vitamins. We actually, with you, we can just keep you on it depends on what you want in essence. We can put you into a birth control pill and keep you on an active pill until we're ready to start. And some of my patients are electing to do that because if you're already suppressed on a birth control pill for several weeks, we literally just have to start the Lupron and the estrogen, and we cut 2 or 3 weeks off of the kind of the build-up period for your frozen embryo transfer. So a lot of my patients, especially if their period is towards the end of April, are either staying on birth control, active birth control pills, or starting them with that.
And just a side note about those who were ready to start their FET, meaning, you know, we know that you've got your little frozen embryos on site and stored with us. We did a video with Dr. Guerrero the other day, our scientific director, and he just wanted to reassure everyone that your embryos, your sperm, your eggs, everything is safe with us. We have, you know, Dr. Guerrero has always implemented the most stringent protocols to protect all of those specimens that he's really upped it in light of the COVID-19 pandemic. So I really encourage you to kind of watch that video. It's on our Facebook and YouTube channels, just to kind of really assuage any fears that you may have kind of about that. So number 3 question is, what guidance can you give to any patients who still need to have their basic workup done?
So the thing that I was talking about at the beginning of the talk, I think are relevant as well for people who are waiting for their workup. So we are doing telemedicine visits, and what that allows for is kind of that initial impression, and for us to kind of talk about your medical history and cater a workup specifically for you. Then, as I'm actually creating a list of my patients who are ready to go for workup or treatment, etc., as things start loosening up and as we have a better idea of when things are going to change, we will be reaching out to our patients to get that testing done, to get that HSG done, to get that semen analysis done, etc. So the goal is that when we come back up, that we can kind of fast track people who already have most of their initial workup done, so that we can get to that planning for treatment phase faster, okay, for you, so that we don't lose too much time. Then the other stuff we talked about in terms of supplements, in terms of healthy living, all very important as you're leading up to attempting pregnancy hopefully in the coming months.
So you kind of touched on, my next question was, what can I do right now while I'm waiting to kind of boost my fertility? Is there anything additional that maybe we haven't mentioned? Because I know right now, I'm sure anxiety and stress is like a huge component, more so than normal for all of our patients who are kind of in the fertility space.
Yeah, and I would recommend, I've actually been doing nightly sleep time meditation, and I actually think that daytime meditation is great as well for stress reduction. I don't do yoga, but I've heard that yoga is really great for that as well. Things that you can do at home, like yoga classes on YouTube, etc., are great. I would say, those are the things that come to my mind. And also, you're home with your partner. If you have a opposite sex partner, track your ovulation. You can order ovulation predictor kits on Amazon, and they can be delivered directly to you. And if you don't have a tubulate factor infertility that you know of already, then go ahead and try. I guess that's another way of stress reduction as well, I guess, right?
Very true. So last question is, I'm getting a lot of messages through Facebook, private messenger, and through email and things. Should patients call and make an appointment now?
I would say yes. Right now, you're going to have a much more captive audience. The doctors were always there for you, but often in the office, we are running from procedures to inseminations to new patient visits to ultrasounds, etc. Right now, you have a very captive doctor who has the time to look over your medical records, to look over what you put into the computer more so. I always try as best I can to really dive deep into those when you come to the office as well. But now, really, you have our undivided attention, right? So I think it's a great time to initiate care. You're going to have more time one-on-one with your doctor, and they're going to be more focused on you. And not all the other people buzzing around behind the scenes trying to make people pregnant every day, right? So, and I think also, let's say you do wait until we're back up and running, seeing patients in the office. I just desanitized my hand, by the way, so sorry. If you do wait for us to get back up in the office and you come in as a brand new patient after that, the fastest you're going to get to a treatment cycle, unless you're like, I'm ready to freeze my eggs right now, or I'm ready to do IVF right now, I've already had a workup, is going to be at least a month to 2 months, because we have to do all of our diagnostic testing, which generally takes between 1 and 2 months, because we have to go along with the menstrual cycle. So if we have already gotten a plan in place, once you get into the office, once we open back up, that will all be fast-tracked. So I would say yes.
Yeah, I think that's